A whisper in the wind, an echo in the canyons of our thoughts, poses a question. Why is head and neck surgery so significant? Why does it hold such a venerable position in the pantheon of medical procedures? Let us dive step by step to understand this. Firstly, as we'll soon discover, the answers are as intricate as the procedures themselves. Head and neck surgery is no ordinary feat. It spans a wide range, encapsulating everything from the base of the brain to the clavicles. Secondly, it serves as custodian of our most vital senses and functions. It safeguards our ability to communicate, our faculty to express emotions, and our capacity to imbibe the world through taste and smell. Moreover, it ensures our basic functions like breathing and swallowing are preserved, thus maintaining our vitality. But the third and perhaps most important point is the complexity of the process itself. How does one navigate this labyrinth of complex structures, this confluence of nerves, muscles, vessels, and it is not a simple walkthrough. The process is akin to a well-choreographed ballet, a symphony of precision and skill. It requires years of study, practice, and experience. To sum up, the significance of head and neck surgery lies not only in its complex and wide-ranging nature, but also in its crucial role in preserving our vital functions and senses. The journey begins with the preoperative evaluation, a comprehensive assessment that serves as the roadmap for the subsequent surgical voyage. Let us delve deeper into what this process entails. Firstly, surgeons conduct a meticulous examination of the patient's medical history. This involves a detailed look at any past illnesses, surgeries, allergies, and an assessment of the patient's current medical conditions. Secondly, they evaluate the patient's physical status, which includes a thorough check of vital signs such as heart rate, blood pressure, and overall body health. Next is the specific characteristics of the disease at hand. Surgeons must comprehend the nature, extent, and impact of the disease to devise an effective surgical plan. This often necessitates radiological studies like CT scans or MRIs. These scans offer a glimpse into the hidden recesses of the body, providing a preview of the terrain to be navigated. The fourth step is the synthesis of the collected information. It's a crucial phase where the surgical team crafts a bespoke surgical plan tailored to the individual patient. This plan, much like a master blueprint, outlines the surgical approach, the necessary equipment, and the anticipated challenges. Concluding the process, the surgical plan is reviewed and refined, incorporating any additional data or considerations that may have arisen. It's a strategy drawn from wellspring of knowledge, experience, and scientific evidence. This step-by-step preoperative evaluation process ensures the best possible outcomes for the patient's surgical journey. As the day of the surgery dawns, the patient is ready to undergo the procedure. Anesthesia is a crucial element in this process, serving as the guard between alertness and the world of surgical intervention. The patient is gently guided into a state of unconsciousness, insensibility to pain, and muscle relaxation, setting the stage for the surgical procedure to commence. The surgery begins with a careful incision, marking the entry point for the operation. Now the surgery unfolds in a series of precisely orchestrated steps, each building upon the last. First, the surgeons make an incision at the predetermined spot, exposing the area in need of attention. Next, they use their expert navigational skills to find their way through the complex topography of the head and neck. Surgeons employ a variety of techniques this journey, from traditional open surgeries to minimally invasive procedures. Each method has its advantages, and the choice of technique is based on the patient's condition and the nature of the issue at hand. In an instance where a tumor is the target, the surgeons carefully separate the tumor from the surrounding tissues, making sure to remove every last bit of it while preserving the healthy tissues around. When structures need repairing, careful sutures are made to mend the damages. If the goal is to restore function, then any obstructions are removed and any weakened structures are reinforced. Each of these steps is carried out with the utmost care, preserving the delicate balance of the surrounding tissues and ensuring the best possible outcome for the patient. The surgery concludes with the closing of the incision, and the patient is then monitored as they regain consciousness from anesthesia. Upon the completion of the surgical objectives, we arrive at the finale of the surgical ballet, the closure. The process commences with the surgeons meticulously suturing the incisions. This is done in a series of steps. First, the deeper tissue layers are closed using absorbable sutures. This is followed by the skin closure, typically managed with non-absorbable sutures or staples, ensuring optimal healing and minimal scarring. Simultaneously, in the backdrop, the anesthesia is systematically diminished. Here too, the process is executed stages, with the medical professionals first reducing the anesthetic gas concentration, then gradually stopping it entirely before finally administering a reversal agent. This gradual reversal gently shepherds the patient back from the depth of unconsciousness to the thresholds of awareness. Once he is safely out of surgery, the spotlight shifts to post-operative care. The initial few hours focus on monitoring the patient's vital signs, managing pain, and assessing for any immediate post-surgical complications. Next, the team manages the surgical wound, ensuring it's clean and infection-free. Nutrition and mobility are gradually reintroduced, leading to eventual post-operative care doesn't cease until the patient has made a full recovery and is ready to return to their routine life. This intricate sequence is the very embodiment of the holistic approach of head and neck surgery, where every step is integral to the process. In the quiet aftermath, as we delve into the process of reflection, several key points resonate. The significance of head and neck surgery lies not just in its complexity, but in its profound impact on the patient's quality of life. The reflection process begins by revisiting the journey from the preoperative evaluation to the postoperative care, analyzing each step. We dissect the complexity of the initial evaluation, the expert navigation of the intricate surgical procedure, and the meticulous attention during the post-operative care. We then move on to the conclusion. In conclusion, the reflection process solidifies the understanding of the significance of head and neck surgery. Its importance undeniable, its process a marvel of modern. This conclusion isn't a simple statement, but a testament to the unparalleled precision, expertise, and dedication inherent in the field of head and neck surgery. The question we posed at the beginning now echoes with a newfound understanding. It's a symphony of skill and science, a ballet of precision and care, a testament to the relentless pursuit of healing and restoration. This in-depth reflection and conclusion process highlights the profound impact of head and neck surgery on a patient's life and the relentless pursuit of healing and restoration in this field.